Today we're going to introduce you to the Health Literacy Toolkit for low and middle income countries. Health literacy brings together many concepts that relate to what people and communities need to make effective decisions about health for themselves, their families and their communities. Health literacy refers to the skills, the knowledge, the motivation, the beliefs, the confidence, the resources and the supports that people need. So the characteristics of people and the things and supports that they need to access, understand, appraise and use information and services to make decisions about health for themselves, but also for their family and their community. Low health literacy has been associated with poorer health outcomes and increased health costs. When we consider this link between health literacy and health outcomes, we need to consider the role of health systems. The term health literacy responsiveness is used to describe the way that services make information, resources, supports and environments available and accessible to people with varying health literacy strengths and limitations. It is in fact this interaction between the health literacy responsiveness of services and the health literacy of those making and supporting decisions that influences the decisions that are made about health. And it is these decisions that are made about health that influence health outcomes. It is critical that we begin to think about how we can address health literacy issues. If we can improve health literacy and we can improve the responsiveness of systems to the health literacy issues of local communities, we can improve health and we can reduce inequities. By enhancing people's access to and engagement with health information and services, we can improve people's opportunity and their ability to make effective decisions, and we can improve the quality of the decisions that people make. And in doing this, we can enhance people's engagement with healthy behaviours and disease screening, treatment and management. So I'm pleased today to introduce you to the Health Literacy Toolkit for low and middle income countries. The Health Literacy Toolkit consists of a series of information sheets that discuss health literacy and the relevance of health literacy to public policy, the promotion of good health, the prevention and management of communicable and non-communicable diseases, and the reduction of health inequities. It provides information and links to further resources that aim to assist organisations and governments to incorporate health literacy responses into practice, service delivery systems, and into policy. The World Health Organisation's Regional Office for Southeast Asia has partnered with Deakin University to develop the toolkit. The toolkit consists of 3 parts. Part A is an introduction to health literacy. Part A consists of 6 information sheets. What is health literacy? The relevance of health literacy for public policy, responding to the health literacy limitations of communities, the Ophelia approach to optimising health literacy recommendations for actions, and resources for the development of health literacy policy and responses. This introductory section of the toolkit has also been published in a smaller booklet entitled Optimising Health Literacy, Improving Health and Reducing Health Inequities. Part B of the toolkit focuses on understanding the health literacy of communities. Part B of the toolkit consists of 7 information sheets. The importance of health literacy measurement, what health literacy measurement examines, approaches to health literacy measurement tools, considerations for the measurement of health literacy in low and middle income countries, the health literacy questionnaire, the information and support for health actions questionnaire. Part B of the toolkit also consists of 2 case studies. Understanding the health literacy needs of a South African community and understanding the health literacy needs of a Thai community. Part C of the toolkit focuses on responding to the health literacy of communities. Part C consists of 8 information sheets. Applying health literacy responses to improve outcomes in maternal and child health, applying health literacy responses to improve outcomes for adolescents, applying health literacy responses to improve outcomes for women, applying health literacy responses to improve outcomes for the elderly, applying health literacy responses to improve outcomes for people with chronic disease, applying health literacy responses to improve outcomes for ethnic minority groups, applying health literacy responses to improve outcomes for refugee and asylum seekers, and applying health literacy responses to improve outcomes for people with disabilities. It also consists of a case study focused on responding to health literacy needs of the Roma in Slovakia. I'll finish today by going through Information Sheet 5, which focuses on the health literacy recommendations for action. Governments, organisations, practitioners and community members must work in partnership to address health literacy issues, contributing to poor health outcomes and inequities within their local communities. There are 5 key messages we'd like you to take away. Number 1, health literacy is the term used to describe the ability to engage with health information and services. 2, individuals and communities have health literacy strengths and limitations that influence how effectively they engage with health information and services. 3, health and social service systems have strengths and limitations in their responsiveness to the health literacy needs of the people they serve. 4, effective responses to health literacy issues can improve health outcomes and reduce health inequities. And 5, policies and practices must promote identification of health literacy issues and the implementation of targeted responses. There are several key considerations when attempting to address health literacy issues. The Ophelia principles provide guidance to projects and help ensure that at each phase, the potential to improve health and equity through health literacy responses is optimised. Principle 1, focus on improving health and wellbeing outcomes. Principle 2, focus on increasing equity in health outcomes and access to services for people with varying health literacy needs. Principle 3, prioritise local wisdom, local culture and systems. Principle 4, respond to locally identified health literacy needs. Principle 5, respond to the varying and changing health literacy needs of individuals and communities. Principle 6, engage all relevant stakeholders in the co-creation and implementation of solutions. Principle 7, focus on improvements at and across all levels of the health system. And Principle 8, focus on achieving sustained improvements through changes to environments, practice, culture and policy. We conclude with 6 key recommendations for action. 1, develop systems for measuring, monitoring and reporting the health of communities, health behaviours within communities, engagement with health and community services, the health literacy responsiveness of organisations, and the health literacy strengths and limitations of communities. Number 2, use available health behaviour, service engagement, organisational responsiveness, and health literacy data to identify local needs. Identify groups of people that have poor health outcomes or less than optimal access to services. Identify health issues or behaviours of concern for the local community. And identify barriers to service access, equity or availability. These barriers may exist within the health system or they may be broader social and environmental factors. Recommendation 3, engage local, regional and or national stakeholders in discussions about local needs and considerations, discussions about universal precautions, determining local priorities for action, identifying interventions and strategies to address priority issues, designing and developing interventions and strategies, implementing and evaluating interventions and strategies, and continuous quality improvement to ensure ongoing effectiveness and sustainability. Key recommendation 4, scale up effective interventions and strategies. 5, develop and implement policy that promote identification of health literacy issues and the implementation of targeted responses. And the final and 6th recommendation is to develop and implement policies that promote equitable access to information and services for all community members. The Health Literacy Toolkit is available for download from the WHO Southeast Asian Regional Office website. You can direct any inquiries to Richard Osborne or Sarita Dodson from Deakin University. Thank you.